All right. Welcome, everyone. Welcome, welcome. Just going to give it another few moments. Please tell us in the chat where you're joining us from today. All right. Okay. So, hello, everyone. Welcome to today's webinar, Why Black Data Matters in Clinical Trial Research. I am Megan Claire Chase, and I am SHARE's Breast Cancer Program Director and host of our BC Life podcast. Plus, I'm a 7-year invasive lobular breast cancer survivor. Now, before our fabulous speaker comes on the screen, I'd like to tell you a little bit about SHARE. We are a national nonprofit that supports, educates, and empowers anyone diagnosed with breast or gynecologic cancers and provides outreach to the general public about signs and symptoms because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, podcasts, and our helplines, please visit our website at sharecancersupport.org. Now, we have a few housekeeping reminders for you. Okay. And they are all participants will be muted during this presentation, but our chat is enabled, so please feel free to chat, write comments, engage with each other, but make sure that you select everyone when using the chat so we can all see. Now, we will show a video and then get into some questions, so please submit any questions through the Q&A section that is at the bottom of your screen. And remember that our fabulous speaker today is unable to give specific medical advice, so please keep your questions general in nature. And we also have closed captioning available. You can enable this feature by clicking on the live transcript button on the bottom of the screen and selecting the subtitle option. This webinar is being recorded, and we'll share this recording in a few weeks with all of the registrants, and it'll also be available on our website. So now I would like to turn the screen over to the fabulous Ricki Fairley.
Hey, Megan, Claire, I love you.
I love you too.
And you're looking fabulous today, as usual.
All for you.
I'm so glad. It's great to be here. It's so great to be here. So I am the CEO and co-founder of Touch the Black Breast Cancer Alliance. I am a 12-year survivor of triple negative breast cancer. I had stage 3A, diagnosed with stage 3A. I did a double mastectomy. I did 6 rounds of TAC. I did 6 weeks of radiation. I became no evidence of disease. My docs had come back in 2 months for a scan. I went back 2 months later, which was almost exactly a year to the date of my diagnosis, and they found 5 spots on my chest wall in the PET scan. My doctor said, "Okay, Ricki, we have nothing for you. You need to get your affairs in order. You have about 2 years to live." And I said, "Well, I can't really die right now. I have a daughter at Dartmouth. I've got to pay tuition. So me and you and God and some drugs or something, we got to work this out." And so I went on Dr. Google, which is not a good thing to do, right? And finally, on the 3rd page of Dr. Google, I found the Triple Negative Breast Cancer Foundation. And I called, who's now one of my dear friend, Haley Dinnerman. And she found me a doc. Probably back then, there were about 5 docs across the country that were actually researching triple negative breast cancer. And her name is Ruth O'Regan. She was amazing. And she put me on what was then experimental for TNBC, carboplatin and gemcitabine. I did a lot more chemo and I didn't die, and it's been 12 years. So this is my God job. I know that God left me here to do this work, and I've been fighting like a girl ever since then to advance science. And I really, we have so many lovely, wonderful breast cancer advocacy organizations, probably because we're all women and we all take care of each other. But I felt like there was a void in advancing the science for Black women. And, Black women have a crazy mortality rate. We're getting breast cancer younger at later stages, at earlier ages. We did a support group the other day, and I had 2 24-year-old metastatic TNBC patients on the Zoom, and it's disheartening to see that. So what we're finding now is that there's a disconnect in terms of cancer research because we now know that a Black breast cancer cell looks different from a white breast cancer cell. So the drugs that we have were never tested on Black women. And so we're seeing this huge, void of like our mortality rates are higher and we're getting younger. We don't know why. We're getting triple negative at 3 times the rate and we don't know why. So we need more science. So that's why I founded Touch. And so I spend every day working with the pharmaceutical companies that make our drugs that we take to find Black women, to basically get more Black women into research and get them more into clinical trials. And that's sort of how we came up with the Black Data Matters mantra. So I guess we can start with the video. Do you want to start with the video, Megan Claire, and then we can talk some more about our campaign. I'll tell you more about it. But this
Yes,
kind of
that
sets
sounds
the
terrific.
stage. Yeah, this sets the stage.
When we trial, we make a difference in breast cancer research.
When we trial, we save Black lives.
When we trial, we defy the odds.
When we trial, we do it for our sisters.
When we trial, we do it for our daughters and our sons.
When we trial, we set a new standard of care.
I was diagnosed with metastatic breast cancer.
I was diagnosed with triple negative breast cancer at 19 years old.
I was diagnosed with metastatic breast cancer at 38.
All you hear is cancer, cancer, cancer. You never think about what the doctor's saying.
Then the doctor looked at me and he said, "Did you hear what I said?" And I said, "Yeah, but I don't know how to be a breast cancer patient."
The numbers for Black women are devastating. Black women have a 41% higher mortality rate than white women. Black women have a 39% higher recurrence rate than white women. Black women get triple negative breast cancer, the worst one, at 3 times the rate of white women. So we're getting breast cancer younger at later stages and earlier ages, and it's just devastating. It's unacceptable.
I know my grandma had it and she beat it, and so I just knew that that was gonna be me as well.
So I think then my fight started, was when I realized, okay, I'm up for the fight for my life. So she said, well, I got this good clinical trial. You can go on it as a second phase. And she said, I think it'll work for you. But the first thing I asked her was like, am I gonna be a guinea pig? Because of our, history with the Black culture.
Over the years, clinical trials for many African Americans have been hocus pocus. So, we know about Tuskegee and Henrietta Lacks.
Clinical trial is no longer a dirty word. It is, it's a halo opportunity. It's a message from God. It's an opportunity for you to live past this moment.
But we need to get more African Americans into clinical trials because we are dying at alarming rates and we have to stop this. We really do.
And right now, there's only a 3% participation rate in clinical trials. And so even the drugs that we're making now, there's no Black bodies being tested. As we built When We Trial, we tried really hard to make it for breasties, by breasties, about breasties, so people could see themselves in what we're doing.
Clinical trials are important. This is top-notch research that we need to have as a Black community.
It's like a butterfly effect. We all gotta help each other out in one way to get to the ultimate end goal.
And I think the onus is on us that are cancer survivors to tell the story. And the least that we could do is be on a trial. But how about for your children? And for your children's children? We gotta do this thing. We gotta save lives. It's just that important.
Ooh, I get emotional
Thanks.
every time.
I know. Val does it to you every time, right at the end. I know she gets me every time too. I've seen it so many times. But so we built this campaign based on a research study. So 3 years ago we did, and then, I'm a marketing person by trade, big player. And so I wanted to understand what's in the head of the patient, right? And we learned very quickly that, first of all, the reason why Black women don't participate in trials is because doctors don't invite them. Hello, right?
Right.
And so doctors don't invite them for a bunch of reasons, racism, illicit bias, whatever you want to call it. They don't want to lose their patients, whatever, right? And so, but secondly, we learned that they really don't understand what a clinical trial is. And so, as I was talking to a few minutes ago, our dear friend Jersey, Blessed Jersey, she passed last December, but she was my aha moment in the focus groups, because she said, Ricki, I would never do a clinical trial because you're going to get the sugar pill and die. Nobody should do clinical trials. You're going to get the sugar pill and die. And it hit me at that moment that, gosh, our blesties don't even understand what clinical trials are, how they work, how the science works. And they think there's a placebo drug. And in cancer research, there is no placebo drug. There is no sugar pill. You're going to get standard of care. But people just don't know that. What does that mean? You're going to get a drug that's already available on the market, that's been tested and approved by the FDA, and people are taking, and maybe either something on top of it or a new drug altogether. And it's frankly the science of tomorrow. You're taking a drug, it's the best science we have for our disease, and you're getting it today, what you can get tomorrow. And you get a better quality of care. And we know that research shows that you have better outcomes from a clinical trial, because you're getting more closely monitored. You've got a whole team of people versus your one oncologist and their nurse monitoring you. You're getting more scans. So think about it. If you are a new blestie and you started a chemo routine, you're probably not going to get scanned for 3 months. So you will have sat in that chemo chair every week or every other week for 3 months, and then you got a scan. Oh my goodness, it's not working. You have progression. In a clinical trial, you're going to get scans more frequently. You're going to have more blood tests, more blood work, more everything, checking, and a whole team of people monitoring you. So if you do have progression, you can act on it immediately. And so you're really getting better care. But our blesties didn't know that. And a lot of them still don't know that, those basic things. And I learned that I could convince a Black woman to do a trial in 5 minutes with a simple message. You know that Advil you took last week? It was in a clinical trial. And they're like, whoa, really? You know that heart medicine I gave my dog Harper was in a clinical trial. The dogs that you gave your kitty were in a clinical trial. And they were like, really? But people had no understanding of what a clinical trial is, that it's really a good thing. And I think historically people want to sort of blame it on the Henrietta Lacks and the syphilis study and how Black people have been mistreated. And those are all out there as a cloud, kind of in the air. But those things have been handled. They're taken care of by the government. There's so many rules around clinical trials now. You really are protected, and you really are in a safer, more protected, more precious environment where people are taking care of you and giving you the best care you can get. Yeah. So we now, so we said, okay, how can we take all this learning that we've found in the research and all these insights and build it into something that would communicate the benefits? And that's how we got to the video. So we now have about 8 or 9 of those videos. So there's a video for each person that you saw in the video. Oh. And we have a video gallery on the website. So if you go to whenwetrial.org and click on video gallery, you can see everybody's story. And that's in that set. And we have a whole nother set of other stories. Like we have a great video with Karen Peterson talking about, Karen, she's one of, she's a miracle like me, and she was metastatic and came out of it. And she was like the first person to sign up for her trial. And she's living and thriving. I think she's 6 years out now. Mm-hmm. And she was given, no chance, like no, like me, 2 years to live or something ridiculous like that. So we just really wanted to break it down. And what we're finding is that if you break it down and give the message from a blestie, we're the voice of trust, right? Not a doctor, yep. Not a scientist, not a pharma company, but from our personal experience, we can convince women to sign up. And frankly, we don't want to die, and this is the best science we have. And, I think also historically, science has been science. Pharma has approached it as science. They have these things called the informed consent, these horrible 40-page documents that have words that you can't spell. You can't understand a word of it. and you give that to a patient, you scare them to death, right? So
Right.
now we're working with pharma to change that language and change it and put in words you can spell and make the materials that people have to read more amenable and more, just easier to digest and understand. And so that's one of the things we're doing. We're also providing a nurse navigator for the process. So we're working now on probably, I think we're on 7 trials now, specific trials, and we're working with 3 pharma companies where we help design the materials for recruiting, but we provide our 24/7 nurse navigator hotline. And so
24/7. Wow.
yeah, Val, yeah. So when the doctor's office closes at 5, you can call Val and she'll talk you off the ledge. And that's what happens. And we get a lot of calls after dinner. So the doctor's office is now closed. The patient has had something happen that day. She went to chemo. She has a headache, whatever. She sits down at dinner with her family and her family's like, well, so what happened? And like, explain it to me. And she can't. So they call us. They call Val. And Val talks them off the ledge. She explains the informed consent to the husband, the daughter, the mom, the auntie, whoever wants to know about it. Because guess what? They think that you're going to get the sugar pill and die too. So we explain to the family and we basically provide non-medical care. So gosh, if you need something in your neighborhood, Val will find it for you. Like, maybe you should take a yoga class, or maybe you should go to Whole Foods. Let me find it for you. And so we find resources for people where they are and support them with navigation, through the trial. So they'll stay in it. So that's something that we just started doing, and it's really paying off a lot. We also do a lot of coaching to PIs. So we're now working with 90 PIs, and it's explaining to them stuff like, do you have a Black nurse in your office? Do you have a Latina nurse in your office? Do you have somebody that looks like me in your office? They don't, a lot of the time. But they never thought of that before. So I said, you're not making our people feel comfortable when they come to you. So we're just trying to change how people think about research. And for a pharma company, and even for the PI, they think of science. But as patients, what do we think about? We think about another birthday, a grandbaby being born, a wedding coming up, a college graduation like me for my daughter, a sunrise, a vacation. We're thinking about time. How can you give me more time? And so we have to change how doctors and the researchers think about what our perspective is. And so Val and I actually just shot these videos. That's what we were going to come out with 3 more videos where we're explaining clinical trials, how I just explained it to you guys. But also, so now what happens often, if a patient is sort of entertaining the concept of a trial, she's talking to her doctor, the doctor then leaves the room to go get the trial nurse or the trial person. So while they're gone, we're made a video that they can reach on a QR code. So the doctor will say, here's a QR code, check out this video. And it's basically just me and Val talking like I'm talking with you right now. Here's what a clinical trial is. Here's why you should do it. And here's how we're going to support you with navigation through the process. And they can interact with us live, on a video without, before they even have to think about the trial details. So just we can warm them up, make them feel comfortable, and give them a hug, to think about this science. So, and that's what's missing. The hug is missing because we're not doing it because we're a molecule or a guinea pig or whatever. We're doing it because we want more time. We want our cancer to go away if possible. Also, we're not, I don't want people to think that you're a guinea pig and it's a last resort. It's not a last resort. It's the best science we have. And when you start talking about lobular breast cancer like Megan Claire had, and triple negative breast cancer like I had, and being a younger person, that we don't know why you're 24 and you have metastatic breast cancer, a clinical trial should be a first option for you. It should be in the set of therapies that the doctor offers you from day one off the cuff, because it's the best science we have. It's medicine of tomorrow. And by the time it gets to a patient, all the bugs have been gotten out about safety. So there's nothing unsafe about it, right? It goes through a couple of phases of trials, of testing before it even gets to a person. So by the time it gets to you, we're now testing efficacy and how efficacious it is relative to some of the drugs on the market. So it's totally safe, and it's totally a great space to be, especially if you're young, especially if you're, you have one of these rarer cancers. So it's really important to think about trials as something, and we don't have Black data. And Megan Claire and I were talking before we got online about some of the side effects that we both have had. And they were really probably from adriamycin, the red devil that we all took, right? The red devil. But, when we did our research, we actually went back in history, and I believe adriamycin was made sometime, maybe late 70s, early 80s, but there were no Black women in those trials. There were no Latinas in those trials. There were no women of color in those trials. So when we start to get Black fingernails or like Black tongues or all the things or neuropathy after, the first session, it's because they don't know. Nobody knows, has the science because no one's tested it on our bodies. We're also trying to get some of the companies that are coming out with newer drugs, since they didn't have Black women in the trials with 3% participation, to do real world data. Let's look at real world data. So drugs like Keytruda, which are changing the landscape for triple negative, it's a great drug. So let's do a study about how is it performing with Black women? How is it performing with Latinas? Since you didn't have us in the trial, we think it's good. If I could go back and say, hey, take Keytruda because these many women or this percent of women did better on that drug, it would be a great thing. So we're having those conversations with pharma as well, just to say, we need more data. We need more information. We need for you to track this stuff and help us figure this out. So we have a story to tell so we can help more people. So that's kind of, the focus of our, a lot of our mission. But, every day I'm a pain in the ass and I tell somebody that their baby is ugly, but I feel like I have to do that. This is my God. I'll give you a hug, but I do feel like we're getting a seat at the table. And I know that and I think you guys saw that with your TNBC study, that our pharma partners are really supporting these conversations and supporting this research and supporting this understanding for us that, I don't want anyone to die of breast cancer, but I really just want mortality rate parity for Black women. And I want mortality rate parity for Latina women. I want to make breast cancer, if we can't get rid of it, can it be a chronic disease? But we need more science. And frankly, we're only going to get more science by getting more of our bodies in the study. So I want people to feel educated and empowered so they can do this work with us, because we can't do it alone. And, it's, we're fighting kind of an uphill battle because we live in a world of health inequity. We don't have health equity, and we're not going to have it until what I say everybody should do is practice the golden rule. What your mother taught you when you were 2 years old: treat others as you want to be treated. So when you get that treatment plan from your doctor, you go back and say, is this what you would recommend for your mama, your auntie, your grandma, your daughter? Because if it's not good enough for them and you're putting them in a trial and not me, it's not good enough for me. So we're trying to educate women and just help them feel good about not being dismissed by doctors, not offered a trial, but demanding the care that we deserve, as all women deserve. So it's really important. You got to put your big girl panties on and be the girl boss of your body, because we're not getting the care we deserve. And we have to fight for it ourselves and ask for it, because there is going to be a way out of this. I have confidence in that. I know we're going to have a way out of this. I have 3 grandbabies. They're now 3, 4, and 6. And I got 10 years before they get boobs to get rid of breast cancer. Their mom, my oldest daughter, she's had a prophylactic mastectomy. Guess what? Because I don't have any mutations. I don't have BRCA, but I have 3 generations of breast cancer on my mom's side. And I have 3 generations of other cancers on my dad's side. And so the fact that we don't have BRCA, because we don't know about Black women, how many Black women need BRCA, whatever, because we have a family history, we said, we're going to make our own data. We're going to make our own data story, because this is not right. So Amanda's going to prevent this thing from happening by having no boobs, having no breast tissue. And so, hopefully we'll get to the point where we do have data about that. But right now we don't. I know somewhere in science, there's a gene that Black women that's causing triple negative in Black women. And we have some studies about that from Ghana. There's a gene called the Duffy gene that we don't test for in the States. But we can't wait for the data to happen without participating in and making decisions for ourselves. So have to keep going.
I mean, Ricki, you have said a word.
Oh my goodness.
I mean, so I am one of those that I used to be totally against clinical trials because of the history, that you
Yeah,
alluded
yeah,
to,
the
the
fear. Yeah.
Tuskegee and Henrietta and all of that. And I was like, oh, heck no, I would never do a clinical trial. No way. Then I get diagnosed with invasive lobular breast cancer. And then, when I'm told, oh, only 15, 20% of women have it. And then I was like, well, how many Black women have it? And no one could answer me. And I was like, okay. So it's like, I'll put that in the back of my mind because right now I just got to get through what I need to get through. But then when it was time for me to enter the survivorship stage, and I was given, the treatment options to try and help
Right.
prevent the recurrence, I had these rare side effects and some side effects that had not been reported with that medication. And that's when it clicked. I was like, oh my gosh, now I understand
Right.
clinical
They don't know.
trials and why it's so important that people who look like us are part of them. Because
Right.
I kept being
Right.
dismissed. Yeah,
Right.
that's not
Right.
from that. And I'm
Right.
like, yeah, it
Right.
is.
It is. And they don't know. I mean, there's so many things that we don't know and we're finding out as patients, right?
Mhm.
So we have to get into studies as much as can. And Megan Claire, there's lots of studies, not just drugs. Like I've done about 8 studies now. Like I did one to measure the things I put on my body. One of the things that are in the environment. I wore these bracelets for 2 weeks. What's going on in my body? What's in my environment? I did a study on stress. On like how you're impacted by stress. Does that cause triple negative? And so there's all kinds of studies, and we have a portal on our website for breast cancer trials. So the other bad thing is that whole clinicaltrials.gov is like going to hell.
Ugh,
It's like going to hell blindfolded. It's a horrible place.
it's a mess.
So that's why we built a portal on our page on whenwetrial.org. So we basically put a hug around it. And so now we can track what happens to women when they go in, what disease they have, and where they get stuck. And so it helps you navigate the whole trial system when you're looking for one to get the match that you need. And we're happy to help you, even coach you through that and make it easy, because sometimes they'll just throw it here. Go look at this website. You're never going to find anything on our website. So how do we do it in a nicer way, with a hug, with information? We have an 800 number you can call as you're going through the process to help you find the trial for you. So whether it's drugs or behavior.
And that is so key, right? Because as we think about how that website, like how a website is designed, is
Right.
really crucial. And then even doctors and other researchers are like, yeah, we don't even know really how to read it, but we know that information in there, like it's good, but it just needs
Right.
to be broken down in a way that can resonate and we can understand what is this
Yeah.
clinical trial about.
Yeah. And what's in it for me? So you go
Yeah.
in and you put in, I have this kind of breast cancer. I'm in this stage. I've taken these drugs, and you put in all your information that right? And it'll give you a match before you having to go through. Even the names of the trials are crazy. So we're just trying to make everything easier, make everything with words you can spell. Make everything change how people present stuff to us. And also give us some control so we can go to our doctors and say, hold on, wait a minute, this is what I want. Or find this for me, or be more demanding. Our research study also showed not only were doctors not inviting women to trials, but even when the patient brought up a trial to the doctor, like brought up the conversation, she still walked away feeling ill-equipped to make a decision. And then she goes home to her mom, who says, you're going to have a sugar bomb. And she can't defend herself to her family because the doctor still didn't spend enough time with them explaining the science, explaining what was going to happen. And so we have to do that work, and we as blesties, we have to do that work. So this is my job. And this is how we have to talk about it and shake people up and say, I need you to talk about it differently,
So, Ricki and everyone, we're getting into our Q&A portion here, and we do have some questions that were submitted and some
Sure,
live.
sure,
So we'll get those
sure.
over to you. But I wanted to kick it off with, when you first started, when we trial, like what were the barriers that you were hitting, and And how did you get through that to get to where When We Trial is now and being able to go across the country, educating the Black community about clinical trials?
So you know what? There weren't any barriers, or if there were, I didn't see them. And maybe that's what it was. So I mean, it's all God. It's all God how he did this. But I felt like no one could answer my questions, so they couldn't say no,
Mm.
right? And so when I went to farm and said, I need a lot of money here to do this work, and they would say, well, why? I would say, because Black women have a 41% higher mortality rate. Black women have a 30, like I spit out all the facts. And so when I said, well, are your drugs working on Black women? Well, we don't know. How many Black women did you have in your trial? Well, maybe one or two. And so when I started asking the questions, they couldn't answer me. So they couldn't say no, right? I kind of positioned it so in a way that I couldn't take no for an answer. And I don't believe in no. It's always how, right? But I just said, you show me what you are doing to contribute either to the bad numbers or the good numbers. Or what are you doing, pharma? What are you doing, doctors? What are you doing, people with money or people with resources? Show me what you got. What's working? Is it working for you? Because if it's not working for you, then we got to work something out here. And that's how I got the money. I mean, I got money to do this work, but it was basically because there is no answer. Because to me, breast cancer right now is in a crisis situation for Black women. It is a crisis. When you say a 41% higher mortality rate, a 39% higher recurrence rate, right? Black women under 35 get breast cancer at twice the rate, die at 3 times the rate of white women before they would have that first mammogram. There are no screening guidelines for Black women with the new guidelines we have. When you start to look at all those things and line them up, no one has an answer for that. And frankly, everybody in this ecosystem needs to play a role. The doctors, the scientists, the pharma people, whoever. Anybody who can touch the word breast cancer in any capacity needs to be responsible and accountable for these horrible numbers. And that's the kind of attention we deserve. And we don't deserve anything less. And so I didn't let anything rain on my parade. Obviously, you could see that. I didn't take no. And I said, well, and even now, I feel like I go to all the, I get the Google alert every day about we need more diversity in clinical trials. And everybody's talking, but nobody's walking the walk. And I can now say that in the 2 years that When We Trial has been in the world, we've signed up 17,468 Black women for clinical trials as of yesterday.
What? Say that number
Yes.
again. Say that number again, Ricki.
17,468 Black women into clinical trial portals. So I'm very proud of that, Megan. But you know what, Megan? It's not enough. It's not enough. But so now when I talk to pharma and talk to people who are supporting us, I can say, well, here's what we did, here's what we got. Can you beat that? Show me. And frankly, I wish everyone would just use our tools. They're on our website. They're free. If you want to convince a Black woman to do a trial, show a video. Show one of our videos. Use our tools. I wish, and part of even the analysis that we did was we looked at all of the major breast cancer organizations, the words on their websites about clinical trials. Go read them. Go read what Komen says. Even, I love you, share, but go read what you guys have about clinical trials. And if you look at the words that you're telling people to explain the science and explain this to them, it's not really working. It's not really working. You could put a link to When We Trial and get all the stuff. It'd be a lot easier for trying to write something that's not going to work, right? So we know it works, and we're just going to keep more of it. The other really crazy thing too. So I went back to the FDA. So this Black women are 3% participation in clinical trials for breast cancer. So I've now talked to 10 people at the FDA saying, okay, what does that 3% mean? Because I wanted to see how my 17,000, what it's relative to. What's going to move the needle, right? So what are the sort of the numerator and the denominator of that fraction to get to that 3%? What are those raw numbers? Nobody could tell me. Nobody could tell me. And frankly, I learned about 3 months ago that the FDA isn't even tracking that number anymore. But the people I've spoken to, the people who work in clinical trials at the FDA cannot explain that 3% to me. So to me, like, how do I move that needle from 3 to 4, from
Right.
3 to 10, from 3 to 40, right? And frankly, the clinical trial participation rate needs to be commensurate with the burden of disease. So if triple negative breast cancer, if Black women get at 3 times the rate of white women, I'm not smart enough to do that math, but that's the numbers that need to be reflected in the trial participation. And so no one's even measuring it anymore. So I have to measure it. I have to measure something. And so that's what we measure, people coming into our portal. And now we can help those people in our portal. We built our own portal so I can talk to them and see them and encourage them and see where they get stuck.
Woo, Ricki. All right, I'm gonna get
And I'm
into
crazy.
I'm gonna get into some questions here.
Okay.
So should someone who is not in active treatment join a clinical trial? Like, are there are there trials for survivors?
Yeah. Call me. I'll get you one. Georgetown in DC has a lot of trials. Those are the ones that I do. I'm like part of this plan where if they have a trial, any kind of trial, they call me. I'm on this list. And I'm sure a lot of cancer centers have those kinds of trials. So you can do trials for all kinds of things: hair loss, weight loss, diet. Like, they're measuring all the things. And frankly, anything we can do to learn about Black women, we need to learn, whether it's whatever it is. So for example, and I should keep answering your questions, but the standard of care thing, like a double mastectomy is equivalent to radiation and a lumpectomy. Have you heard that?
Yep.
Get it, it's going to be fine. There's no difference. So where was that study conducted? Sweden. So how many Black women were in that trial?
Yeah, I was going to say, what?
Right? They're all blonde and blue eyes. So, and I love Swedish people, but so I don't feel like that's a good therapy for a doctor to recommend to a Black woman. And I have been thrown out of a few doctors' offices because I brought that up. But I will ask a doctor in a heartbeat, what you're recommending to me, how have your Black patients fared? With your personal experience as an oncologist, how are your Black patients doing on that therapy or with this drug or with whatever?
Ooh.
Ask the question. And you kind of throw them off guard. And if I were your kid or your mama, what would you do? What would you do if you were Black? What would you do if you were Black or Latina or whatever, or Latin? And throw it in their face. And, they don't love that, but I don't really care because it's about my life and your life and our lives.
So I'm being asked, what is the 1-800 number for clinical trials? Is there like,
Yeah. So if you go into our portal and start the process of finding a trial, but you get stuck, there's a number in there. I don't know what it is. I can find it for you, but there's a number in the once you're in the portal and it can kind of tell that you're struggling or need help, and then it'll pop up and show you who to call.
And it's whenwetrial.com, right?
.org.
Whenwetrial.org. Thank you, Michelle. Whenwetrial.org, Michelle. So just go there and see what that number is.
Check out the video gallery, and you can go in there, and it'll say search trials. If you go into the search trial button, it'll take you into the portal.
Perfect. So, when we think of clinical trials, and I know we've talked about triple negative breast cancer, are you seeing like clinical trials where it's for DCIS in Black women, lobular in Black women? Like, how are you determining like where, I guess, the growth of clinical trials are going per subtype?
So, you know what? I can't really tell you by subtype. I mean, frankly, most of the trials should be for metastatic breast cancer because that's what kills you, right? But there are trials. So, for example, like drugs like Keytruda, which has been a miracle cure for triple negative, first was approved by the FDA for metastatic. But they very quickly, like within I think several months, were able to get FDA approval for early stage, which is great because who wants to be metastatic? They don't have to be. Trodelvy right now, the other really great drug for triple negative breast cancer, it's a third-line metastatic drug. It's made by Gilead. So they actually have a bunch of trials for early stage. So to try to get that drug approved for early stage triple negative breast cancer, since we only have one. And so they're all stages, all subtypes. There's a lot of trials for her too. There's a lot of trials for really every subtype. And frankly, Black women die more readily of breast cancer at any stage, any age, zero included, any age, any subtype. So we need research across the board. Frankly, we all know that early detection or getting breast cancer before stage 2 is curable, right? And so your odds of dying are significantly less. So clearly it would be great to have drugs for that stage to prevent, from illness. But we need all the drugs, all the stages, all the subtypes, and they're all out there. There's trials, a lot of trials for everything. And we're happy to help you find one. We're happy to help you find one.
Well, I mean, and you also brought up another good point of genetic testing and then clinical trials, because when I got genetic testing and they told me, I had an unknown variant, and I was like, well, what does that mean? They're like, oh, well, we don't know. I'm like, what? You don't know. And then and as you said earlier, you were like, yeah, though it didn't show I had BRCA, my mutations, like, we don't know what the other mutations are that would directly affect Black women. And so, like, what do you say when you're out in the communities and a Black woman asks you that question? Well, why should I even bother with genetic testing anyway? Or why should I even bother if I'm not going to be included or still not going to be included?
Well, you want to know because, first of all, it can dictate the types of drugs you take, genetic and genomic testing. But frankly, with Black people, family history is equivalent to your genetics almost, right? So I don't have BRCA, but I have a huge family history. So that's why my daughter got her boobs cut off, right? So you have to know your her. We say know your her story. We actually have a really cool that worksheet on our Love of My Girls site that helps you sit down with your mama and your grandma on both sides of the family and fill in all the stuff for really all the Black diseases, kidney disease, diabetes, and all the Black cancers, lung, prostate, whatever. So we want to foster those conversations in Black households. And it's really important to know where you came from because it could dictate anything. Because there actually is a study happening right now where colon cancer in the dad led to triple negative in the daughter. Hello, that's me. So there's so much, none of this research we have. So anything is good, but the family history and, Black people, we don't talk about hell at the kitchen table until Uncle Pookie gets his leg amputated or Grandma Edith is in hospice. How'd that happen, right? Because we don't talk about it. So we're trying to foster those conversations. So we have an HBCU internship program, and they're these lovely, lovely, badass little young women, juniors and seniors and at Black colleges. They're pre-med, and they work on our TikTok. I've never been on TikTok, so I can't tell you what they do, but that's not true. I've been on it, but they make these amazing videos, and their role is to be the conduit in their family to foster these conversations. That's what we pay them for. It's a paid internship. They make videos for their peers, but we ask them to sit down with their both grandmas or their mama and relatives and talk about cancer and talk about breast cancer and talk about breast health. Because if Black breast cancer is a thing, Black breast health is a thing. So learn your risk and know your her story. So we basically challenge them to be the hero of their family. You be the one at the family reunion that stands up. Nobody can eat the chicken until we talk about history. And to foster these conversations. The Ad Council did a study a few years ago, and it said 92% of Black women are aware of breast cancer. Probably even higher now. 25% actually talk about it with their friends and family. 17% act on the risk.
Whoa.
Scary, right?
Yeah. Wow.
So we got to be talking about this more. And I hate, like, the woman that was on at the share panel of the TNBC study. Look at that woman. She was 38, right?
Yep.
38 with TNBC. I think she was stage 3 or 3B or C. And her mom and her aunt had triple negative, and they never talked
And
about
she
it.
didn't know. Yeah. Yeah.
And she didn't know that her mama had it till she was sick. Isn't that crazy? But that's the secrets that we are keeping are killing us. And so we have to make this cancer thing not that C thing that you whisper about, but something that, who doesn't have a cancer story in their life, whether it's a friend, a family, somebody, right?
Right.
And we're getting it younger, like every cancer we're getting younger, and colon and all the, they're getting them younger. So well before you would screen. So we got to talk about it as much as possible. And
I mean,
genetic testing genetic testing is critical, but it's even only part of the conversation.
true. And I did see a question. Can you still be tested for can you still get genetic testing post-treatment?
Oh yeah,
And
for sure.
yes. Yes.
Yes.
In
So
fact, we just had a podcast episode. So if you go to Share Cancer Support in our BC Life podcast, where I talked with a genetic counselor, and it is important, especially the further you get out in your survivorship.
yeah,
Like even my breast cancer surgeon recommended to me last year. Okay, y'all, I will do it. I will do it. But to get another genetic
yeah,
testing with
it
a broader
changes.
panel,
Yeah,
and I
yeah,
wanted,
it's
yeah, like, so have you done that? Is that something that you are
yeah,
encouraging the
yeah.
touch
I
community to do?
yeah. Yeah, I've done 2 different panels. One when I was sick, and I did one a couple of years ago. And it's funny, when I finished it, when my doctor called me with the results, I said, "Well, what I get?" She's like, "Yeah, is that a good thing? I have no genetic mutations." Like, Ricki, who knows? Because we had just heard about the Duffy gene. But my Dartmouth roommate, she had breast cancer a year after I did, and so now 11 years ago. And so her doctor retired. So she went in for a checkup. This is 2 years ago. She went in for a checkup. So now she's like 8 years out. And her a new doctor said, "Hey, did you have genetic testing?" And she said, "No, what's that?" And it's funny because 10 years ago, I didn't even know enough about genetic testing to ask the question for help to help her, right? Because I was still that fresh in it. And so she has BRCA, and she's a daughter and a son. So she actually had her ovaries removed 2 years ago. And so, she's 8 years out, but thank God that doctor had the wherewithal to ask her to do it. And she had BRCA. She has BRCA. And so now her daughter, who's 25, is being screened. But had that not happened, and also, so it's not only for you, but it's for your kids and your family. Like my daughter had the benefit of me to get a prophylactic mastectomy. But how many families don't know that?
Right. Right.
So it's paying it forward too,
And so let me ask you this: when you've been in a clinical trial and then talked with other Black patients who have been in clinical trials, how did they deal with that anxiety? Because yes, it's like you've gotten them to sign up. How are you working toward making sure they actually like get there and take part in the clinical trial? And of course, there's always, you can stop at any time. That is your right. But
Right,
how did
right.
you help them get over that anxiety of like, okay, now I've signed up for this. Okay, I got to show up to that first appointment.
So frankly, you're in a clinical trial every time you do any chemo. Think about it that way, right? So when you went to sign up to take your Red Devil treatment, you didn't know what was going to happen to your body, right?
Right.
There's some data from other people having that experience, but frankly, you had different side effects anyway. So every time we do any treatment as women, as Black women, we're in a clinical trial because you never put that stuff in your body, right?
Mhm.
So it's really no different from a treatment, and you're going to either treat your cancer or not, right? So
Right.
I would think about it that way. But also, again, it's the best science we have. You're getting tomorrow's drugs today. You are saving yourself. You're saving yourself. You're saving your life, and you're giving yourself more time. And you have the power to do that. So why wouldn't you exercise that power?
Do you have any when we trial.org, like, are there locations? Like, are you looking to like have chapters of when we trial across the country and have different sites to like sign people up?
Funny you should say that. So we like to say, so last year we did 70 events. We've done 20 already this year, all over the country. I don't sleep in my bed a lot. But we like to say we go where Black women live, work, play, pray, and slay. And we don't go to health events. We go to hair shows and churches, and we do go to all the sorority and Blinks and Jack and Jill and all the Black women's organization events. But we try to go into the community where we can talk to women when they're not thinking about health and catch them off guard. And I like to call it making intervention. So we do something crazy. So when they walk away from us, they remember us. So like we went to Essence Fest last year, and we took over the alleyway by the casino that everybody has to sort of walk through to get to the town. And we put out a big dance floor. I had a DJ and blasted music and danced in pink tutus and big pink hats. And I've had at least 10 people call me from getting something in that bag that we gave them. You know, my mom had breast cancer. My daughter, I found this bag from the thing you did at whatever Essence. So we try to intervene in their lives. We're actually doing a big event at Martha's Vineyard this summer in August 13th. Come go with us. We're doing a thing, we did it last year, called Sisters on the Vineyard, and it's like a health fair for Black women with all different diseases. We're having Sunny Hostin is our keynote speaker from The View, and we're gonna do Bexa scanning at the venue at the event, and then we rented a house in the middle of the video. This is where the Black bougie Black people go in August, right? And so all the leaders of all the community organizations are there. It's a great place to meet influencers, but we're going to do Bexa scanning in our house that we're renting and just make a stink. So Haley, you know, my crazy Haley child who I work for, she made really cool bikinis, love of my girls' bikinis. So we're going to walk the beach in bikinis and talk to people about breast health. But that's what we're trying to be iconic in how we show up. And I am impatient about being iconic. If you did it last year, I don't want to do it again. I'm going to find a new way to think about it, a new way to talk about it. And I won't accept what happened last year. I don't want to hear about it, because last year, if it didn't work, it's not going to work this year. So we're always trying to think of new, fun. And you know, somebody was telling me how, oh gosh, what you're doing is really fun. I'm like, it's not fun. Okay. We're not trying to even make light of it, but we're trying to make a point in a different way, to educate in a different way. And Haley was an elementary school teacher before she came to do this work with me, and I was a marketing person. So I think between marketing and how to educate and how to people observe, you know, receive data and receive information, that's what we try to work on and try to be different about it. So.
You know, and I love that. And y'all don't worry, we'll keep you posted of when Ricki's got that information on that.
Oh yeah. Oh, I didn't answer your question. Oh yeah, I didn't answer that question though. So yesterday I sent an email. I will send it to you today. And we're building a network of Black women-led grassroots organizations across the country. And so I want to be in 50 states. So now we have 90 organizations in 43 states. It's called Belong. And Belong stands for Blessed Empowering Leadership and Opportunity and Nurturing Growth. And it's an organization for leaders. So we know we have all these Black women out there. And you know, in every city, there's some athlete whose mom died of breast cancer, they started a foundation. Or some mom whose kid died, you know, so we're reaching out to all these women who probably never been to a SHARE conference, never been to ASCO, never been to SABCS, but they're in the trenches doing the work, taking care of people, driving them to chemo. And so we want to help those women and bring them resources and tools and information. So we're going to do a webinar every month with one of our medical doctors to talk about what's the latest thing on lymphedema, what's the latest thing on whatever, on neuropathy. And then we're doing an every other month coaching session, like support group coaching session for leaders. So how do you deal with the stress of this horrible disease and people dying? How do you take care of yourself? How do you, do self-care? How do you coach people about clinical trials and basically help educate these leaders to do better work in the community? So we can't be everywhere. So we're trying to find these tentacles. And also we're partnering up the smaller organizations with local PIs, with local clinical trial sites, so they can have them to recruit from and have someone in their community to recruit from. So we are trying to be in the community in deeper ways. So.
That is fantastic. And in case anyone doesn't know, PI stands for Principal Investigator. Wow, that's amazing. I mean, Ricki, you do such amazing work. I did want to make
Thank you, honey.
sure, someone asked if you could elaborate on that Duffy gene and its relation to breast cancer in Black women.
Yes, so I don't know a lot about it. It was discovered by Dr. Lisa Newman at Weill Cornell. She's an incredible breast surgeon who's been working in Africa probably for 15 years now.
Mhm.
And Melissa Davis, who was working in her office, but now is the head of genomics at actually an incredible badass title at Morehouse School of Medicine.
Yes.
So they discovered it a few years ago, and they're doing still more research to figure out, but it is not now on the U.S. panel. So we're working with Dr. Melissa right now. She just got a Cancer Grand Challenge Award, and it's a 5-year study in the U.S., the U.K., Ghana, Nigeria, South Africa, Ethiopia, and Kenya. And it's a study for breast, prostate, and pancreatic cancer. And it's basically looking at the biology of a cancer cell and why a Black cancer cell is different than a white cancer cell and what needs to be done differently across the social determinants of health, the genetics, the genomics, and the epigenetics, which is the environment. So we're helping her with the patient advocacy in this country. So we're going global. I'm not sure how yet, but we're going to Ghana in September to try to figure it out.
I think you're going to bring some share people to Ghana too. We're coming
Yes,
with you.
you come on with me. Come on with me. I'm so happy. I mean, but we need more data. We need this. But Black Data Matters. We need more data, and so we're so blessed that Melissa invited us to help her do this research and help her recruit patients.
Yeah. Yeah.
So
here's a question. How are we to support and encourage those individuals who are okay with trying but are not comfortable or trusting with doctors? Like, we know that, okay, maybe you're saying that clinical trial is safe, but how do I know that that doctor is really seeing me and saying this is the best trial for you?
we all have guts. In your gut if it's not right. Right. And I think if you feel uncomfortable, then it's not right. Use your gut. I mean, use your judgment. I mean, most doctors have good intentions.
Mhm.
Do they have illicit bias? Yes. Are some of them racist? Yes. That's why we're coaching these babies in med school to help them not be that way when they grow up. But if you don't feel good about the conversation you are having with your doctor, then you need to go find someone else. And I think it's in your gut. It's no, if you don't feel safe with your doctor, how can you're not going to trust whatever happens, right? And so something is making you feel that way, right? If you know what it feels like when something feels good or bad. Use your judgment, use your gut, and call somebody. Call me. I'll go with you. I'll Zoom with you. I mean, I'll get on FaceTime with you. We'll get, and we can always get another opinion. We have this medical advisory board of 15 amazing Black women doctors, and I call them all the time, hours of the day and night, and they text me back. But we'll help find another opinion for you. But it boils down to how you feel and how this doctor makes you feel. And we used to have a blessee. She died last year, but she used to say, she used to walk into the office and say, "I want the Ruth Chris appointment today. I do not want the McDonald's drive-through appointment today. I want the appetizer, the cocktail, the salad, the main course, the dessert, and the aperitif. And if you're not going to give me that, then I don't want to be with you. But I do not want you to run in and out here. Take your hand off the doorknob and talk to me." Right? And so you have, and if they're not giving you that care, then, we need to find another one. And we can help you find one, but there's plenty of doctors out there. But if you know in your gut and you don't trust, what that feeling is like, that agita, that anxiousness, that's stress, that's stress. If they're giving you stress, that's my filter. Like if you're feeling weird, that's stressing you out. You don't need that stress. Get somebody else.
Well, Ricki, we are at time and I cannot thank you enough. I can't believe you're like sitting still for longer than an hour because you are all over the place, which is amazing of what you have created and continue to be an innovator in this space, and that is why it is so important. And I'm so glad you came here today to talk to our shared Black community on why Black data matters. We matter. And
We matter.
I can't thank you enough. That's right. So everyone, thank you so much for joining us today.
Thank you.
Please make sure to check out SHARE's website for some upcoming educational programs, podcast episodes, support groups, and make sure that you follow us on social media as well. And when you pop off here, you'll be hit with a survey. Please take those. They are anonymous. We will read them, and that helps drive our content. So again, this concludes our webinar. And Ricki, you're amazing. I love you. Thank you.
I love you, love you, love you. Thank you so much for having me. Everybody have a blessed day. Check your breasts. Talk to your families, you know, do the work.
Yes. Bye,
Love you dearly,
everyone.
my girl. Bye, everyone. Take care. Blessings.